Assalamu alaikum wa rahmatullahi wa barakatuh. Our most cherished viewer, welcome once again to your program Health Check, a program where we discuss health issues regarding our lives, and we bring to you medical experts to give us advice regarding certain ailments affecting our lives. With me today is our friend, a brother who's been regularly coming to give us medical advice. That is Dr. Baker Akaturinda. You're most welcome.
Thank you, sir. It's my pleasure to be here.
Thank you so much for always honoring our invitations. And the topic of discussion today is about the breast fibroadenomas. The term is quite new to my ears, and I require to know what the breast fibroadenomas are from you, Dr. Baker.
Yeah, thank you. First of all, breast fibroadenomas are benign. That means non-cancerous, not cancer, non-cancerous lumps in the breast. They are composed of glandular and connective tissue. So they are not cancerous. That's number one to note. Benign is a medical term which means non-cancerous.
Okay.
So they don't spread to other body parts. Yeah, they
are not contagious.
They're not contagious.
Leave alone other body parts. It cannot move from you to me.
No, it does. It can't. It cannot.
Okay.
Yeah, it's for one body and also one part.
Okay.
So it can't. It's not contagious and it cannot spread in the body as well.
You can't find it in the ear, in the thighs, only in the breast.
Only in the breast, and it is, like you said, non-cancerous. It is usually painless. Painless, yeah. So it is not pain. If being is paining, then there is a call for action. But they are normally, we say, they are benign, non-cancerous lumps in the breast, usually in women of reproductive age, from around 15 years to 35 there.
Okay.
Yes.
What causes these lumps in the breast?
We say idiopathic. Idiopathic means, in medical, it means the cause of a disease is not known. Unlike malaria, where we say the cause is Plasmodium falciparum, or we say the cause of AIDS is HIV virus. Here, the cause is not known. So it is idiopathic.
Okay.
Yes.
So it is not known.
Yes.
Is this question relevant or irrelevant? Can stress or diet cause them? Do you see it as relevant? Because you've just told me the cause is not known. Yeah,
true. The cause is not known. It is idiopathic, but you have what you call risk factors.
Okay.
So there are risk factors which predispose a person to having this. Why we say the cause is not known is because there is no specific causative agent that we can say this bacteria or this virus or this protozoa has caused this lump in the breast. No. But there are risk factors where we can say a person who has this, who is in this condition, is most likely to have breast lumps.
Let's dive into the risk factors now. What are those?
Yes, thank you. Like we said, these lumps are common. Breast fibroadenomas are common in women in reproductive age. Most of them from 15 years to 35 years there. So a lady who is in that age is at a high risk of getting these breast fibroadenomas. And also, like we said, the cause is not known, but the risk factors. One of them is hormonal changes. Why do we say so? Because in this period of 15 years, 35 years, is when a lady is undergoing those changes. From 15 years, she's in adolescence, she's developing breasts in size and like that.
Okay.
So those hormonal changes can bring those breast lumps. Now, hormonal changes usually happen when a woman is in her adolescence age, or like you said, reproductive age, but also in pregnancy. We know when a woman gets pregnant, she no longer goes into her menstruation periods because now she's pregnant.
Okay.
So the hormone responsible for the menstruation now is regulated, is put to a halt. So there is change of levels of hormones depending on if she's pregnant or not. Then also I can't fail to mention hormonal treatment, or we call it hormonal therapy. What do I mean here? Any medicine which you take that interacts or changes the hormones, for example, contraceptives. because the use of contraceptives is to alter the hormones.
Okay.
Because contraceptives are important to help a lady not to conceive. They do so by altering the levels of hormones. So if a person is on hormonal therapy, it can greatly contribute to having these breast fibroadenomas.
Okay.
So therefore, if a lady, anybody is using those contraceptives or drugs which affect hormones, she is at a greater risk of getting these breast fibroadenomas. Maybe finally, before I forget, there's what you call a family history. If a person has a history in their family, her grandmother had breast fibroadenoma. Maybe her mother also has breast fibroadenoma. Then even her, we say, she's a high risk of getting that breast fibroadenoma. Why? Because in her lineage, family lineage, her blood, they have that family history. Yes, so those are the risk factors. We can't say they cause, but they predispose a person to having the breast fibroadenomas.
Thank you so much, Dr. Baker Akaturinda. Now this brings me to the symptoms and signs. How can a woman detect or find out that I might be having or soon will get breast fibroadenomas?
Yes.
How does one detect?
Yes, one, fibroadenomas, they are lumps. So when a lady is doing, you call it a personal examination of the breast, you will feel some lump in your breast. So when you feel that lump, it is a sign that you have a breast fibroadenoma. And also that lump is painless.
Yes.
So you will touch it and there's no pain. And then that shows that a person has fibroadenoma. Also, one of the characteristics of this fibroadenoma is that they are movable. A lady, when she's palpating it, when she's massaging her breast or squeezing her breast to check for this fibroadenoma, they can feel the lump and it can be movable from one place to another. In the same locality, yes, but kind of movable. So
it can shift to kind of here to here.
As you are moving your hand on it, yes. As the lady is moving her hand on it or her finger, the lump can somehow move. It is not stuck in one place. It is immovable.
Okay.
Yes, because it is in the breast tissue. And therefore, those can show you that this person has breast fibroadenoma.
Okay.
Yes.
Thank you so much, Dr. Baker Akaturinda. These lumps, like you said, they are painless. Should we assume, because you said it's painless, should it be much of a concern when one gets a breast that term confuses me.
Yeah, fibroadenoma.
Fibroadenomas.
Yes.
Yes. Actually, let me call them lumps.
Yes, yes. Now, these breast lumps, much as we said that they are non-cancerous, they are benign, but unfortunately, they can turn into malignant. The opposite of benign is malignant. The opposite of non-cancerous is cancerous. So if they are not given proper attention, some of them can turn into cancer. That's why we say, yes, much as they are benign, they are not cancerous, but it is important to monitor them. It's important to check them, lest they turn into cancerous. Yes. So there is a danger if we don't monitor them.
From what you've explained, it's as if it's very easy to be detected. Since it's a lump, you can touch it, you can feel it. Do we have types of these lumps?
Yeah. True,
breast lumps. Can you explain a few of them?
We have some, the type of the lump depends on the size and the complexity of the lump. There is what you call simple breast fibroadenoma. That one comes and is small in size, like you said, painless, and easily moves by itself. It goes away by itself. Like we said, it is caused by hormonal changes. So when the hormone stabilizes, it also goes by on itself. doesn't require any treatment, doesn't require any, it only needs monitoring, like we said. You monitor your breast lump, and if it is very small, later it goes by itself. Now there's what you call complex fibroadenoma. Now this one is kind of bigger in size, larger than the first one, because this one is close to 2 inches. So that one also sometimes it goes by itself, because like we said, caused by hormones, may not require any medical attention, but the person monitors by herself. Now there's what you call giant fibroadenomas.
Okay.
Now these ones are big, are large actually. They are beyond 2 inches in size, or even further. Now these ones will not go by themselves. Now here, dear viewer, you need to go to a doctor for what you call surgical removal.
Seriously?
Yeah, this is now a serious case. The person goes to a doctor, and using the medical means, surgery actually, they remove the breast lump, they suture, and the wound heals, person gets back to normal.
Okay.
Now these are the ones when left can easily turn into cancer. So we encourage these ones, these giant fibroadenomas, to be removed surgically, medically.
Okay.
Yes.
And now this brings me to another question about the treatment. How do you treat these breast lumps once one is diagnosed with one?
Oh, thank you. Now, usually in treatment,
because you've talked of the first treatment, you've talked about the surgery.
yes, yes, yes.
Do we have some other options?
Yeah, true. They're there. In treatment options, like you said, surgery for those giant fibroadenomas, but there's also what you call cryoabrasion. Cryoabrasion is freezing the lump using some medical means. They subject the lump to some medical means and it is frozen within. So it is not removed, but is frozen. But also, one of the treatment options is monitoring. The other small
The one
lumps,
that is frozen, won't it become a problem in the near future?
No, it will not. It will not. Because remember, it is benign. Maybe we shall discuss later the diagnosis, how we diagnose them.
Okay.
But you will find out that there is a test where they will do and they discover that this is absolutely benign. I mean, absolutely non-cancerous.
Okay.
That one, they will just freeze it and nothing happens. But for the...
So before you go to another one,
Yes.
once it is freezed,
Yes.
can someone still feel it when they touch it?
Not really.
Okay.
Not really. It is frozen completely and
It's as if it has never been there
Exactly,
before.
exactly.
Okay.
The tissue gets back to normal. The breast tissue gets back to normal.
Okay.
Yes, there is also monitoring. I had mentioned about this, but it also comes in the treatment because we have those fibroadenomas which are simple and they are small in size. So the doctor will not give you any treatment, will not do any surgery on you, but he will just tell you, go and monitor it. You keep checking it every day. Any day, every evening and morning when they are bathing, you are required to check your breast. So you'll be checking this lump, then with time you will discover it has completely gone away. That is also a treatment method, checking, monitoring.
Okay.
Yes.
Thank you so much, Dr. Baker Katurinda. Does these lumps increase the risk of breast cancer, should we assume? Yes, there are some that are non-cancerous, but you said there are some that once diagnosed, they tell you at a certain stage they will be cancerous. Should we assume they increase the risk of breast cancer?
When they are not properly monitored, they can turn out into cancer. So these fibroadenomas don't cause cancer, and they don't increase a person's chance of getting cancer or a person's risk. But it is important to monitor them because there are some types, like we said, the giant ones, which can turn into cancer. So if a person does not monitor and ignores, it can lead to cancer. But fibroadenomas, they are completely non-cancerous.
Okay. You've talked about different ways of how you diagnose these lumps.
Yes.
Can you give us a hint on a few of them?
Yeah, true. One, clinical examination. This means you go to okay, first of all, a person can do a personal checkup on these breast lumps. A lady, like we said, whenever she's bathing or whenever she's in her room, she can use her mirror and checks her breast for any lump. It's very healthy to do so. That's the first stage, number one, to diagnose if the person has it. Number two is going to a hospital and she sees a doctor. The doctor will check the breast clinically, will examine it, and will tell whether this person has a fibroadenoma or not. There is another way we can detect this, diagnose this, is by doing what you call imaging. Imaging, like you hear, is image. Take an image of the breast.
It's like screening or...
Yeah. But here we use different types. Like we have what you call ultrasound scan of the breast, and the machine can tell, the sonographer will tell you, will give you a picture and will give you a report that shows that you have a fibroadenoma, the size, the what, everything, the description of it. But also there's what you call MRI, magnetic resonance imaging. So that one is also a way of imaging, that they will take the breast and tell whatever is inside. So those can also tell. Some can do X-ray, but basically it is that ultrasound scan and also MRI. This is what we call CT scan, contrasted tomography scan. That CT scan also can tell detailed how the breast is and if there is any breast lump in it. Now the last one, and which is a determinant one to know if it is absolutely cancerous or non-cancerous, is what you call biopsy. Biopsy is, I can explain it in a simple language as what you call tissue. We pick a tissue from the breast, from this part where the lump is, actually from the lump itself. We may not remove the whole of it, but we pick a small tissue from it. Now, this tissue is taken...
Small tissue, by this you mean a sample?
Yeah, a sample, yes, of this lump. Now, this sample is taken in the laboratory for what you call histology, analyzing the tissues, the cells of this sample from the lump. Now, the laboratory technicians will tell us if it is cancerous or not. If this sample is cancerous, then definitely it means the mother of this sample, which is the lump, is also cancerous. So once the laboratory report shows that it's not cancerous, then we can conclude and say this lump is not cancerous. And therefore we can think of the other things of surgery and what, when we are well sure that this person...
either cancerous or not
cancerous, when we are sure what it is. Yes. So those are the four methods: clinical examination, personal examination, then clinical examination in the doctor, by the doctor, then imaging using those scans and what, then biopsy, tissue sample from this lump to confirm whether it is cancerous or not.
When someone finds out it's not cancerous but requires a surgery, is it okay someone to do self-surgery or medication at home? Yes,
well, that is dangerous again now, because long ago our great-grandfathers could do those surgeries, but they had their own, we can say, complex means of preventing infections. They had those spirits, alcohol, what, which now we don't have. So if anybody dares to do a surgery at home, that will be dangerous. We encourage to come to hospital, and the doctor, the surgeon, does surgery. It is very, very safe and very, I can say, painless actually, because they can give you anesthesia. They remove the sample. Actually, I want to allay the fears of our viewers. Don't you fear that you'll go there, cut you, you feel pain. No. They give you anesthesia. They remove your lump when you are not even feeling, and you will feel when it is already done.
By this anesthesia, is someone completely shut down?
It will depend on the analysis of the surgeon. They can do a complete shutdown of the person.
Because that's what most people fear.
But usually these breast lumps, we don't do complete anesthesia, total anesthesia, no. Because it is just one part of the body, the breast. They just anesthetize that part and they remove. Actually, remove when a person is seeing.
So anesthesia, because I want our viewer there to understand these things and these terms actually to their day-to-day life. Anesthesia, you mean that, is it an injection? Is it tablets that someone takes to avoid pain? Are they like painkillers? How can you explain that term anesthesia for our viewer to understand?
Yeah, true. Anesthesia, very important actually, because when we talk surgery, we must talk about anesthesia.
Exactly.
Well, it is very painful. In the US, long ago, some surgery was conducted on a slave without any anesthesia, and I can imagine the pain she went through.
Okay.
Terrible pain. So we give anesthesia now. We don't want to cause pain. Anesthesia simply means removing the pain from the part which we are carrying out anesthesia on, sorry, surgery on. So we don't give tablets. There are also tablets, but usually now we give injection. We give injection just once, and the sensation is lost of that part. So whatever they are doing on that part, they are cutting, they are moving, they are suturing, the person will not feel the sensation. Okay. In other words, will not feel the pain. Okay. So it is painless. It is very painless. So
one should not carry out their own surgeries at home. I hope we are all at the same page, our beloved viewer, because it's very dangerous for you to carry out these surgeries by yourselves, much as it might not be a dangerous lump like the doctor said, but when it comes to a stage where it has to be a surgery, don't do it at home. Let the experts or the surgeons do that, because it's them that know better which nerve is okay. If it comes to cutting, which one is dangerous, that should not be tampered with. You don't have that knowledge. So don't tamper with any lump, much as it's not cancerous, it might cause some other issues. That is as per the doctor. It's very unfortunate. This is the time we have to call off our program. I remain your host, Nambali Bashir. Let's meet next time. Same station, same time. Assalamu alaikum wa rahmatullahi wa barakatuh.